What does obstructive sleep apnea have to do with your heart? And more importantly, your heart health? See, we just explained that sleep apnea, when you're sleeping at night, it's actually putting your body through a moment of crisis. And depending on how often and how long you've been going through that, those crises can last seconds to minutes and happen dozens of times a night, if not per hour. So what's actually occurring in sleep apnea to cause this reaction in the body to have it linked to all of these cardiac diseases like high blood pressure and stroke, and even worse, heart attacks that happen in the middle of the night, sudden cardiac arrest? What's actually going on in the body, in simple terms, is that we're causing inflammation. That's where our blood vessels are actually swelling and causing our blood pressure to skyrocket. That's known as silent inflammation. And when that occurs in our body due to that low oxygen dip throughout the night, the low dips and come back up, low dips, come back up. When that's occurring, it's actually creating this constant inflamed state in our body. So inside, we're actually swollen. And what's going on is that hypertension or high blood pressure that keeps going up over time is causing stress on all of those blood vessels throughout our body and our brain. And we know that a stroke is where one of those vessels pops and bleeds inside the brain. So it's not really a big leap of faith to go from having high blood pressure, meaning a constant high pressure inside of our blood vessels, to one of those vessels in our brain, which are the most sensitive, over time popping and exploding. So it makes sense that from the not sleeping well and the oxygen crisis our body goes through to causing high blood pressure where we're always in a swollen state to then cause a stroke where one of those vessels pops. It makes sense as it goes across. The other thing that can occur is the constant pressure that it's putting on our heart. You remember that we talked about the heart racing and then slowing down. They call that a brady-tachy syndrome. That means a slow to fast heart rate. And then it slows down and it goes fast, and it slows down and it goes fast. All of this while we're supposed to be sleeping at night. So these moments of crisis and low oxygen are adding up over time to actually create heart risk for all these diseases that can occur. The worst of all is sudden cardiac death while we're sleeping. Now, we know that there's different stages of sleep and there's different levels of apnea during those stages. One of the most common stages you've probably heard of is called REM sleep. That's where most of our dreams occur at night. When we're dreaming, our body's actually paralyzed from the neck down. So during that stage of sleep is when the majority of apnea actually happens. We also have seen studies that correlate that stage of sleep and the majority of apnea happening to the same time that most cardiac arrests or heart attacks happen, where people die in their sleep. So we know that apnea is directly correlated to oxygen loss. We know that that oxygen loss is connected to heart disease, and heart disease over time can lead to a heart attack. Now, if you know someone who's passed in their sleep, possibly from sleep apnea, I'm sorry to hear that. I have friends that have passed from that. This is a very serious topic and not one to joke about, but it's also one that we can affect a huge amount of people, including yourself, your friends, your family, anyone that you know that may be suffering from this, to make a decision to change that course. You see, apnea will take our lives and our health on a course that goes down. And if we can impact that course and change the trajectory, we can completely change the outcome by affecting apnea so that it doesn't affect our health. That's how apnea affects your body, and I truly hope you will take that message to heart.